Well, good afternoon and welcome. I'm Ken Weinstein, CEO of Hudson Institute. I'd like to welcome our audience here today at the Betsy and Walter Stern Conference Center and our audience watching online to today's event, Doing Healthcare Reform Right, Putting the States Back in Charge, featuring Senator Orrin Hatch. My colleague, Tevi Troy, will introduce Senator Hatch momentarily. We are delighted to welcome you, Senator, here to Hudson Institute and honored to have you address us here today. Let me simply say that 2011 marks the 50th anniversary of Hudson Institute, which was founded by the late futurist Herman Kahn in 1961. Kahn had huge faith in the power of technology and markets to improve the condition of mankind, both in the United States and around the globe. And our legacy of cutting-edge health care policy research dates back to the 1960s, and early work on the importance of innovation as a key factor in extended lifespans. Our healthcare research today domestically is anchored by Hudson Senior Fellow Tevi Troy, who is the former Deputy Secretary of Health and Human Services. While the budget Tevi manages here at Hudson is a little bit smaller than the $716 billion he dealt with at HHS, his work continues to play a major role in the nation's healthcare debate. His articles on healthcare and healthcare reform have appeared in almost every major publication of note, including a cover story in this month's Commentary magazine, and it is with great pleasure that I turn the podium over to my colleague and friend, Tevi Troy.
Thank you, Ken. I'm not only privileged to be able to introduce Senator Hatch today, of whom I am a great admirer, but I also will be moderating the question and answer period afterwards. So if you have questions after the Senator's presentation, we look forward to hearing them. As Ken said, I was formerly the Deputy Secretary at HHS, and in order to get that title, I had to go through the United States Senate. And one of the rituals in the nomination process is something that is known as courtesy calls. These are meetings where the individual nominees go up and they meet various senators, and the senators tell them what they think. And I always thought, in general, with many senators, that the title courtesy calls is a bit of a misnomer. I know I experienced some lack of courtesy among some senators, and of course the most famous story in this regard is of Judge Robert Bork, who's also a Hudson Fellow, who was terribly criticized by members of the Senate Judiciary Committee, including the late Senator Kennedy's famous comments about, in Robert Bork's America, people will lose all sorts of freedoms. And then when Kennedy and Bork actually met in the courtesy call, Bork wrote in his book that Kennedy did not look at him, and he just put his eyes away and said, "Nothing personal, nothing personal." Well, I certainly didn't have anything like that in my courtesy calls, but they were certainly very odd. And not all of them, as I said, were courteous. But I will say that the one I had with Senator Hatch was incredibly courteous, and he gave the title its deserving meaning of a courtesy call. And not only did I appreciate his courtesy during the courtesy call, but I also appreciated his strong support for my nomination. He helped me get over the top, and I'm very grateful to you, sir. I am also appreciative and grateful for Senator Hatch's strong stance in criticizing President Obama's health care bill. Senator Hatch took the wise course of opposing it on constitutional ground, and he made strong arguments saying why the approach that was taken was not a constitutional approach. And I would bet that members of the Obama administration, after they read Judge Vinson's recent decision, were thinking that they had listened a little more carefully to Senator Hatch's careful criticisms of the bill in advance of it passing. I know that when then Speaker Pelosi was asked about the question of constitutional challenges to the bill, she said, "Are you serious? Are you serious?" Well, it turns out, as we saw from Judge Vinson's decision and from Judge Hudson's decision, that the constitutional concerns are serious, and Senator Hatch posed those concerns in a very serious way, and we're appreciative to that. We're also appreciative for his efforts to promote the states as laboratories of democracy, to take us to the next level of healthcare reform, to have the states serve as places for experimentation and new policy and reform to take place, so that we can actually have the best healthcare system and one that works for everyone. So with that, I will welcome Senator Hatch and have him speak about that subject. Thank you.
Well, thank you so much for that kind introduction. I really appreciate being here. I love this institution and appreciate all that you do. Thank you for having me here today. appreciate the kind introduction and for your generosity providing this venue. The Hudson Institute is well regarded as one of the most fair and, dare I say, most balanced think tanks in Washington. I'll try my best to live up to its reputation. But I'd also like to say that you made a great pick in bringing Tevye Troy on board at Hudson. There are a few people in Washington who know as much about health care, and most importantly, the problems with our nation's health care system as Tevye does. He understands the essential point that the primary problem with our nation's health care system is that it is already dominated by government, not that it suffers from inadequate governmental intervention. Having said that, let me just say that I want to express, I'm sure all of your hearts and prayers go out to those who have suffered from, in Japan, from the Japanese tsunami that occurred overnight. It's really amazing to have won well over 8 points. I mean, that was pretty interesting. And I just hope they can reduce reduce the effect and recover as many people as they can. I think we all join in prayer for that reason. Now, as you may have heard, we are coming up on an anniversary. On March 23rd, 2010, President Obama signed into law the Patient Protection and Affordable Care Act. To the uninitiated, that would be Obamacare. To Celebrate Families USA, the advocacy group that promoted the health care law, is delivering Obamacare birthday cakes to members of Congress. I would not be surprised if the cake comes with a cash-on delivery, much like the law it's celebrating. The health care law was sold as necessary to reduce health care spending, but the real bill came due after delivery. You might recall that one of the essential turning points in the life of this legislation, one of the key moments that brought supposedly reluctant Democrats on board, was the procuring of the carefully massaged score from the Congressional Budget Office, showing that if all the Democrats' assumptions held true, no matter how unrealistic, Obamacare would save money. Now, these scores were trotted out to provide cover for Democrats who felt that they had to look fiscally responsible. The funny thing is that the more Democrats in Washington said that spending $2.6 trillion on a new entitlement will reduce the deficit, the less the American people believed it. After the bill was passed, we continued to see the facts come out on its true cause. I suppose then that Speaker Pelosi was right after all. We would have to pass the bill to find out what was in it. So as we approach the one-year anniversary of Obamacare, it is worth revisiting this law. What exactly was in it? And where should we go from here? At the risk of setting off my family, I'm going to, making my family mad, I'm going to tell you a joke that in my view sums up our experience with the health law. My wife and kids tell me that I should not go around repeating the jokes that I get emailed to me, but this one was irresistible in the light of our conversation today, so it's very illustrative. So bear with me. A cowboy named Bud was overseeing his herd in a remote pasture when suddenly a brand new high-end luxury car came speeding toward him. The driver jumped out of the car. He was wearing a fancy new suit and the hippest sunglasses as well. Full of confidence, he asked the cowboy, "If I tell you exactly how many cows and calves you have in your herd, would you give me a calf?" Our cowboy Bud looked at this young know-it-all and then looked at his herd and said, "Sure, why not?" So the young man whipped out his notebook computer, connected it to his cell phone, surfed to a NASA page on the internet, called up a satellite, and scanned the entire area into a ultra-high resolution photo. He then opened the photo on his computer and exported it to his image processing facility in Hamburg, Germany. Within seconds, he received an email on his BlackBerry that the image had been processed, and after uploading it to a government database and using the newest predictive computer models, he printed out on the LaserJet printer in his trunk a 150-page analysis of the herd. The young man then turned to the cowboy and said confidently, "You have exactly 1,586 cows and calves." Watching the young man select one of his animals and attempt to stuff it into the truck of his car, Bud asked him, "Hey, If I can tell you exactly what your business is, will you give me back my cow? The young man thought about it for a moment and then said, okay, why not? Bud then said, you're an aide in the Obama administration. The young man could not believe it. Bud was right. And he asked Bud how he was able to guess. Bud explained that there was no guessing required. You showed up here even though nobody called you. You want to get paid for an answer I already knew to the question I never asked. You used millions of dollars worth of equipment trying to show me how much smarter than me you are. And you don't know a thing about how working people make a living. For that matter, you don't know much about cows. This is a herd of sheep. Now give me back my dog. I just couldn't resist. But in the end, the fight between progressivism and conservatism is a fight about the ability of government to manage the economy. Conservatives understand that markets might be messy, but with some exceptions, if left alone, they create optimal outcomes. Obamacare is another in a long line of progressive efforts to interfere with free markets and restructure the economy in ways that professional bureaucrats seem rational. The problem is that these bureaucrats have little understanding of how businesses and markets work, and in their desire to bring greater rationality, they create inefficiencies and even higher costs. The ink was barely dry when the significant and unexpected costs of the health care law, costs not anticipated by the progressive legislators and staffers who sought to control 1/7 of the American economy, some say 1/6, until that became clear. First out of the gate was the impact of eliminating the tax break for Part D premium and assistance for businesses. As required by law, following President Obama's signing of the health law, a number of large corporations announced significant write-downs in response to the elimination of the Part D subsidy deduction. Over $1 billion in losses for businesses. Now, this was not the type of message Democratic legislators were anticipating just weeks after Obamacare became law. So what was the response of the health care law's supporter? Naturally, it was not the government's fault. For progressives, it is never the government's fault. Rather, it was the fault of these businesses for telling the truth. The Secretary of... I thought that was funny, by the way. You guys didn't, but I thought it was really good. The Secretary of Commerce, Gary Locke, went on television and said that these write-downs, which again were required by law, were, quote, irresponsible, unquote. Now, the Democratic-controlled House Energy and Commerce Committee announced a hearing that would look into these. They would look into these write-downs. It was only when the committee realized that a hearing would embarrass those who supported this proposal to begin with that they pulled the plug on the hearing. But this skirmish was only the beginning. With its rolling effective dates, Obama was loaded with a series of time bombs set to go off. Next came the debate over the provision, one enacted in the mad scramble for dollars to pay for the health law's coverage expansions, requiring businesses to report all payments in excess of $600 for services or merchandise to the IRS on the 1099 form. It soon became clear that this would be an enormous and unnecessary burden on American businesses. Though bipartisan majorities in Congress agree that this provision should be repealed, it remains law today. In fact, we went through 5 votes in the Senate, I think it was at least 5, before we finally repealed it with 82 votes. That doesn't tell you something, I don't know what does. And it still isn't enacted because the Senate is unwilling to take the House version. And we're going to get that done. But the difficulty of repealing even this one onerous provision is worrisome, given the much bigger issues that remain to be resolved in the health law. And there are many of them. This week, the Wall Street Journal predicted or reported on the new restrictions on the purchase of over-the-counter drugs. Again, in a haphazard effort to raise funds for coverage expansions, Obamacare required that individuals receive a prescription from their doctors prior to purchasing over-the-counter allergy medication with their flex spending or health savings account. Now, you now have the spectacle of mothers calling pediatricians so that they can get prescriptions for infant Motrin and diaper rash cream. And let's not forget that this provision was included in a bill designed to improve access to primary care, reduce costs, and increase efficiency. Given these goals, it is hard to conceive of a more counterproductive proposal. And of course, we can't forget the benefit requirements and so-called consumer protections. Some of you probably recall that as this legislation was being developed, it occurred to its advocates that there were no goodies offered up front, so they inserted Title I in the law, a host of new requirements that they could then sell to interest groups and constituents. The process of enacting these new requirements has been chaotic. The departments involved have had to issue sub-regulatory guidance in the form of releases, notices, frequently asked questions, and model notice language samples to clarify and revise previously issued rules. And after issuing all of these new regulations, the administration had to provide exceptions to these mandates. Just recently, the administration hit a real milestone. They have now approved over 1,000 waivers of the benefit requirements in the health law. Apparently, these requirements do not come without disruption and cost, given that plans covering more than 2.6 million people have been exempted from these consumer protection requirements. And these are just the issues that have emerged so far, and it's amazing how many of those people are union members. The real fun has not even started. The premium subsidies for the new health insurance exchanges have not even gotten rolling yet. The IRS is already hiring agents to administer the billions in premium assistance that will be pushed out the door under Obamacare. I will be monitoring this closely because if history is any guide, these premium subsidies will be rife with abuses and mistakes that will ultimately cost taxpayers unnecessary billions of dollars. Now let me ask you a question. We have an educated group of people here in this room, a group that has a sophisticated understanding of how government works. What about the operation of federal programs to date? Should give us confidence that the original estimates of the cost of these coverage expansions are not massive understatements. Don't take my word for it. Just yesterday, the Congressional Budget Office concluded that, quote, growth in health care costs will almost certainly push up federal spending significantly relative to GDP under current law, unquote. That was yesterday. I wonder about the revelations in the future. The CBO continued, quote, spending for Social Security, Medicare, Medicaid, and other health care programs will grow from 9.9% of GDP in 2010 to 12.0% by 2021, driven largely by rapid growth in health care costs, unquote. Small wonder that we're spending 25.3% of our GDP as we sit here, going up every day. Expenditures, an expenditure quotient that hasn't been in existence since 1945, at the height of the World War II. Even the Obama administration's own chief actuary concluded that national health expenditures will increase due to Obamacare. And he's a Democrat. He's an honest Democrat, like many are, but I particularly think he is trying to do his best to please them. Maybe this is why Doug Elmendorf, the director of the CBO, testified last month that Obamacare would reduce the number of jobs in the labor market by 800,000 at a time when we need more jobs. In the end, the health law might be over 2,000 pages long, but it is not that complicated. A Democratic Congress urged on by the president passed a $2.6 trillion, that's if we're lucky, health care law with massive new subsidies for coverage without addressing the long-term costs of care. And how did they, quote, pay for, unquote, these new and expanded entitlements? Obamacare increased taxes by at least $800 billion, and many of those taxes will just be passed on to patients in the form of higher health care costs. They also cut nearly $530 billion from a nearly bankrupt Medicare program, not to make Medicare solvent, but to create and expand other unsustainable entitlements. Obamacare is a sinking ship. And when it starts to go below the waves, the very groups and organizations that sought refuge in deals with the White House will be the first groups Democrats turn to for more money to fill the holes. And they better understand that. So, first things first, we need to repeal that law in its entirety. The House has already voted to do so. And then, along with my Republican colleagues in the Senate, I voted to repeal Obamacare in its entirety. Now, short of repealing Obamacare wholesale, we will do so retail through a death by 1,000 cuts. We will fight this until we win. 1099 repeal is a good start, but we're not going to stop there. I've introduced a bill to repeal the $20 billion tax on medical device manufacturers that was included in Obamacare. This tax is a perfect example of some of the perverse consequences of this health care law. Recall that Obamacare was sold to the public as decreasing costs and improving economic growth. Under this health law, medical devices ranging from surgical tools to bedpans will now get hit with a 2.3% excise tax. My bill would immediately repeal this tax, which is slated to take effect in 2013. Medical device companies employ nearly 500,000 people and pay a salary that is nearly 40% higher than the national average. And that's without unions. The industry is also one of the leading net exporters in the United States. A $20 billion tax hike on medical device manufacturers to fund Obamacare will cripple an important engine of opportunity, job growth, and innovation, while hurting the advancement of technologies essential to improving patient care. If I sound like I'm mad, I really am. It's really bad. Furthermore, these tax hikes will only result in higher insurance premiums and increase the cost of medical devices. Rick Foster, the president's own actuary, believe me, agrees. He stated in his analysis of the health overhaul law that the tax on medical devices will, quote, generally be passed through to health consumers in the form of higher device prices with an associated increase in overall national health expenditures, unquote. The medical device tax might be an affront to our economy and to common sense, but the individual mandate is an affront to our Constitution. I have introduced legislation to repeal the unconstitutional individual mandate. This one provision is the keystone to Obamacare, and removing it will severely undermine the administration's ability to exert full control over our citizens' health care programs. I've also introduced legislation to repeal the employer mandate, the job-killing employer mandate. In a time of record unemployment and extreme uncertainty about the burden of thousands of pages of new regulations coming out of the White House, the last thing employers really need is another costly mandate. What the administration seems to have missed is that the employer mandate will not only harm the economy by forcing employers to lower wages and freeze hiring, it will also result in higher health care costs for employees. The health overhaul law provides large incentives for employers to drop coverage, leaving employees with the option of purchasing insurance through the exchanges. When this happens, employees will see a dramatic increase in their premiums as they lose the tax advantages of employer-sponsored health care. If you think premiums are high now, just wait until 2014. But once Obamacare is dismantled, and I am confident that it will be, what will emerge in its place? Well, I know what the president would like and those who brought about Obamacare. If this president is reelected, I can almost guarantee, in fact, I can guarantee that within a few years, they'll throw their hands in the air and say, this is not working, we've got to go to a single-payer system. In other words, a Washington-run system, the worst possible system you could have. We need to have a clear replace and repeal that lowers health care costs and fixes our unsustainable entitlement programs. But that takes presidential leadership. Mark my words, you can't do it without it. And right now, we don't have it. The bottom line is that just look at Libya if you want to. Here's a chance for us to strike a blow for not only democracy but for freedom. And I'm not saying we should get involved militarily, but we certainly could help the people who are going to overthrow this tyrant in the Middle East. And there are many ways we could do that. And they're sitting there and diddling in the White House. And in the State Department, by the way. It's hard to believe. And if you think about it, I'm sorry to get off on this, but I can't help myself. As the former longest-serving person on the Senate Intelligence Committee, look up the name Ms. al-Sadr. Ms. al-Sadr was the equivalent of the Islamic Pope for Shiites in Lebanon. He was one of the most respected people in all of the Shiite kingdom. And he decided to make a trip to Libya in the middle 70s and was never heard from again. And Shiites believe that Gaddafi killed him. I believe they're right. And if this president would strike a blow for these Shiites who are fighting for their freedom, I think it would send a message to everybody in Shiite kingdoms all over the Middle East, but especially to Iran, that America is their friend. Well, I divert. But I can't help myself sometimes, because I'm in the middle of so many things up there. Like I say, we need to have a clear-cut replace and repeal, after repeal, that lowers health care costs and fixes our unsustainable entitlement programs. But that will take, again I'll say, presidential leadership. You can't do it without it. Because people in Congress are afraid that the president will demagogue these issues if they do it by themselves. The bottom line is that any solution to these problems needs to be state-based. Step one will be relieving states of the massive fiscal burdens imposed by a relentlessly expanding Medicaid entitlement. Along with the 2009 stimulus package, the health law imposed new Medicaid eligibility restrictions on the states called maintenance of effort requirements. That's a very important phrase to remember, maintenance of effort requirements. The lack of flexibility that maintenance of effort imposes makes it especially challenging for states to solve their unprecedented budget crises. This is a typical case of an out-of-touch Washington making life unduly difficult for states and localities. States are facing a collective $175 billion budget shortfall through 2013. California alone has a $25 billion budget gap to close on its own. And to put this in perspective, Democrats in the Senate balked this week at cutting any more than $4 billion from an omnibus appropriations bill of over $1 trillion. Yet while facing this crisis, Washington has tied the hands of the states. Medicaid consumes an average of 22% of state budgets. States are simply asking for relief from federal mandates to better manage their Medicaid population. Under current law, the options of states are limited. Due to federal eligibility restrictions, states are limited to cutting benefits that are not federally required, reducing payments to providers, and raising taxes. Due to Washington's intransigence on maintenance of effort requirements, some states are now being forced to consider cuts of up to 20% of their higher education budget. And maybe their elementary and secondary education budgets even more. The administration's response on this issue has been completely inadequate, and I will be introducing legislation easing federal Medicaid restrictions on state governments. The fiscal reality of this situation we are in demands that we do this, that we do so. And if you think what's happening across the nation in places like Wisconsin and California is bad now, just wait until the Medicaid expansions in Obamacare kick in. With at least 20 million individuals becoming Medicaid eligible in coming years due to the health law's Medicaid expansion, the budget pressures on states due to Medicaid are only going to get worse. By the estimates of the Senate Finance Committee Republicans and the House Energy and Commerce Committee, Obamacare's Medicaid expansions will cost state taxpayers at least $118.5 billion more through 2023. That's on top of the $175 billion that they're in the hole now. Candidly, forcing states to do this is not just unrealistic and irresponsible, it is immoral. And that is without even getting into the tremendous problems with access and the quality of care in the government program that is Medicaid. That is not even getting into the unacceptable fraud, waste, and abuse problems with Medicaid, which we found are astronomical just this last week. Clearly, this government program is broken and it has to be reformed. In a compelling article in yesterday's Wall Street Journal, Dr. Scott Gottlieb, a clinical assistant professor at New York University School of Medicine, argued that government Medicaid coverage is worse than having no insurance at all. More broadly, it is also critical that any replacement for Obamacare be state-based. For all the talk about flexibility, the health law provides a one-size-fits-all solution to coverage in the states. The bottom line is that Utah's health insurance exchange will not exist under Obamacare. The coverage available in existing Utah exchange will not meet the coverage requirements required by Washington. Secretary Sebelius has incorrectly described Utah as one of the models for the state exchanges that will exist under Obamacare. In fact, Utah, as great as their exchange approach is, would be denied approval today if it were to ask Washington to certify its exchange. That makes you wonder, what about the leadership at HHS? It's a tough job, but they at least know what they're talking about. Its request would be denied, Utah's request would be denied because it does not meet Washingtonian standards. This is amazing to me. The Utah exchange provides flexibility. It's an honest-to-goodness free market system that provides a portal for Utahns to shop for insurance. All carriers are welcome, and benefit requirements are extremely limited. This is the future of health care, freedom and choice, not government-dictated standards for who can compete in the exchange and what products they can offer. When Congress repeals the health law and replaces it with something more workable, it needs to make certain that the states are enabled to act as the 50 laboratories of democracy. Unfortunately, Obamacare sidelined the states. Don't let them fool you. The president's recent embrace of a plan that would merely change the date on Obamacare's state innovation provision from 2017 to 2014 does not put states back in the driver's seat. It does not loosen the new federally dictated benefits requirements in the exchanges. States will still have to, get this, offer coverage at least as comprehensive as the federally mandated essential benefits package. A truly workable health care reform would be modeled on the bipartisan and highly successful welfare reform of the 1990s. I had a lot to do with that. That took ideas from the states, not just Washington, and gave them considerable flexibility to operate their own programs. Fact of the matter is, within 2 years, because we said we're going to help you, we're going to give you sustenance, we're going to give you job training, but within a certain period of time, if you don't have a job and you haven't gone to work, you're off the dole. Within a couple years, 2/3 of those that have been on dole, some for generations, were working and having the self-esteem that comes from working. That's the difference between the Washington program and one that makes sense. Frankly, this is what our Constitution of Separated Powers and sovereign states really demands. There is an enormous reservoir of expertise and experience in the states, and any federal reform of the nation's healthcare system should take advantage of this state-based wisdom. And the states can take advantage by looking at other states and seeing what works in their states and what might not work in their state, and then pick the best and get it going in their state. The states will be the center of Republicans' healthcare reform effort. Now, let me just say a word about Medicare. The fact is we do not, no, I'm going to restate that. The fact is we do need to have a discussion about entitlement. If we want to preserve Medicare for future generations of Americans, we must get serious about ensuring its fiscal solvency. Unfortunately, Democrats have shown time and again that they are not serious about reforming Medicare. Rather than use health care reform as an opportunity to shore up an already vulnerable Medicare program, Democrats instead took $529 billion out of Medicare to fund new entitlement spending, unsustainable entitlement spending. Our Medicare program is broken. It will cost $370 billion over 10 years just for a doc fix. But instead of taking this head on to fund Obamacare's new coverage expansion, Democrats brazenly, and I can say Democrats because it was all Democrats who passed this bill, they brazenly stripped Medicare of billions of dollars while claiming that they were putting the Medicare program on more solid footing. Both the CMS actuary and CBO agree that this double counting would not pass mustard in a second-grade math class. Yet this gimmick was central to the financing of Obamacare. And now that seniors are realizing what the new health law truly means for the program, Secretary Sebelius is trying to divert their attention with false claims that the modest reductions in discretionary spending being proposed by Republicans would undermine seniors' access to Medicare. Now let me be clear about this scare tactic. It is totally baseless. This week, Secretary Sebelius argued in effect that H.R. 1, the House-passed fiscal year 2011 appropriations bill, would prevent HHS from carrying out the provisions of the Medicare Advantage program. If that were the case, then the CBO score of H.R. 1 would have reflected that fact, or the fact that Medicare would cease making payments to Medicare Advantage plans and paying other claims. The fact that CBO made no such finding indicates that the Department's view of H.R. 1 is fallacious. And despite Secretary Sebelius' claims, H.R. 1 is intended to halt Obamacare's harmful cuts to seniors in the MA program and stop implementation of the unaffordable new entitlement program. H.R. 1 is an appropriations bill that does not change the fact that Medicare is a mandatory spending program, which means seniors are still entitled to their full benefits under the law. Ultimately, any debate over entitlements requires presidential leadership. Now, I believe that if President Obama had led, if he had done a Nixon goes to China on entitlements, he would have found both Republican and Democrat support. But he chose not to, and this is unfortunate. The Bowles-Simpson Fiscal Commission pointed the way toward meaningful reforms. As an example, they would have paid for the Medicare doc fix and Class Act repeal through proposals such as the establishing of a unified Medicare deductible. That proposal alone would save $110 billion through 2020. That's important stuff, and it's amazing to me. But the administration offered up nothing in its budget. Believe me, Republicans are concerned about Medicare, and if the president is serious about addressing Medicare, the single biggest threat to our country's long-term fiscal health, he will find Republicans on the Hill who are willing to talk, and I'm one of them. But we are still waiting for that call. We face many challenges on health care, but ultimately I'm hopeful. The fact is, our nation cannot continue on its present course. Eventually, something will have to give on both health care costs generally and Medicare more specifically. My only hope is that we start down the road of real reform sooner rather than later. Thank you so much for listening. I appreciate you.
Well, thank you very much for that profound explication of what we face in healthcare and how to proceed to fix the problem. Senator Hatch has graciously agreed to answer some questions. I'm going to take moderator's prerogative and ask the first question. You will be second. And just say, Senator Hatch, I completely agree with you that we need presidential leadership on so many of these issues that you mentioned. But I've noticed that President Obama seems to have a tick when he says, I'm reaching across the aisle. I want Republican ideas. He always says that, and then he says, but. And the but is, but the coverage has to be as robust as everything we would provide, and you have to have the same government regulations, and you have to have the same expansive view that I have. How do you build trust when you kind of have that two-step that he's engaging in?
Well, in the case of corporate reduction of taxes, you've got to have, uniform revenue neutrality, which is just another way of saying we need more taxes. All I can say is that I like the president personally. It doesn't sound like it in these remarks. And I don't like what he's done in these remarks. I don't like that. He's charismatic, he's intelligent, he's articulate, he's handsome, he's all of the things that you would hope a president might be. Although I think it's time for some ugly presidents, so who have the right philosophy. All I can say is that we are willing to work with him, but take Obamacare. I was down at the White House 3 days after the inauguration, meeting with Rahm Emanuel, Larry Summers. Then Joe Biden walked in. There were countless staff people there. Then the president walked in, and we talked for about 45 minutes. And then the president said, I'd like you and Joe to come back with me to the Oval Office. I said, that'd be fine. So as I was walking out the door, Rahm grabbed me and pulled me back. He said, can we do health care? I said, sure. He said, how? Well, Senator Kennedy was ill up in the Cape, and he was up there, and I said, well, call Teddy and tell him to tell his staff to work with Orrin and do what Orrin asked him to do. Now, that sounds arrogant, but Teddy would have known what I meant by that I would have put together a health care bill that conservatives and liberals could live with, that would work, and that it would have bipartisan support. Well, I think he did call Ted. And Ted came down, as sick as he was, and we met in his room right off the floor that Harry Reid had given to him. He had both dogs there, and as you know, he had those Portuguese water dogs, and they were just beautiful, that didn't like me very much, although they got used to me. And he said, we're going to do that. Next thing I knew, we were writing a bill in the Help Committee that was totally opposed to almost every, well, that was the threshold of this bill. And I went to one of the top Kennedy staffers. I said, look, Teddy would never have done this. He said, this is a direct quote, I don't care what Senator Kennedy wants. This is what I want. I mean, that's the attitude. And then all of a sudden we find, well, I was in the original Gang of Seven in Senator Baucus's office. And I saw that he had very limited parameters. And I knew I knew pretty exactly what they were going to do, and it was something I couldn't support. And so rather than continuously walking out of there and finding 20 national media people there and raising issues that were on my mind and contrary to what I knew they were going to do, I finally absented myself from the Gang of Seven. It promptly became the Gang of Six. But even then, after the Finance Committee passes out a bill that was passed out with only one Republican vote, the real bill was written in Harry Reid's office and Nancy Pelosi's office with very few administration people involved. And you can see the mess we're in. It's a terrible bill, and all I can say is, in all of this process, I didn't see the president weighing in except on a totally partisan basis. And your discussion of that is very accurate. Now, I don't see him weighing in on a lot of things that take presidential leadership in order for Congress to have the guts to do what has to be done. Entitlements are certainly in that gang, and there are many, many others. Sorry to go on. I'm sorry.
No, that's fine. I completely agree with Senator Hatch, and I was following the healthcare debate very, very closely, and I recall that initial bill that came out of the Help Committee that you were talking about was scored by CBO as costing over $1 trillion and only covering about 15 million people, and it was a disastrous, and they kind of followed that course from then on. We had a question here in the front row. Microphone.
Yes, sir.
I must say, we always considered him a great hero.
Well, thank you.
My question, Senator, well, healthcare is one aspect of our economy, not part of the market. What would you think of foreign doctors post online what they charge, so people can take that into consideration?
I think it's a good idea, and I think they ought to have to post more than that. They ought to post their specialties and what their experiences are, and a lot of other things. you're talking to somebody who was, at one time in his life, was a medical liability defense lawyer, defending doctors, hospitals, nurses, healthcare providers, and so forth. And, you know, the president says he wants to do medical liability reform. They'll never do that. Some of the big, at least one of the two biggest hardcore or hard money contributors to the Democrats in Congress and throughout the states happens to be the personal injury lawyers. They're not going to take them on. But unless we do that, I said 25 years ago that unnecessary defensive medicine, we all want necessary defensive medicine, but unnecessary defensive medicine is in the neighborhood of $300 billion. I have no doubt that's where it is, because 95% of those cases that were brought to get the defense costs. They were frivolous. And the insurance companies would pay them rather than take a chance on a runaway jury. I just cite that as one thing where the president could have really said, instead of just saying, I'm for medical liability reform, he should have said, and here's what I would do. And if the Republicans will work with me and Democrats will work with me, I'll be flexible in getting it done. And that's what leadership is all about. You can't help but like the president. I'm not trying to sugarcoat this, but you can't help but like him. He is intelligent. He is a fluent, articulate human being. And he's enjoyable to be around. But he's got to lead. And I've got to tell you, he didn't lead on health care in my book. He turned it over to minions, and he's not leading on anything else that I can see that requires working with Congress. I should say that. I'm sure he's leading on in some areas, but these are real important issues. And I remember working with you. It's great to see you again.
Yes, we have a question over there.
Thank you, Senator Hatch. I really appreciate your comment. My question is that Utah is one of the 26 states that are part of the Florida lawsuit, and yet it's also received over $20 million in Obamacare funds. And one of the things that Judge Vinson said was that the fact that all states except two have begun implementation and accepted funds undercut their argument that he could halt implementation. So I guess my question is, do you think the fact that Utah has received, so many other states have received these funds that are available under the law, undermines the legitimacy of the Florida lawsuit? And if so, would you recommend to Governor Herbert that he return the funds to Washington?
That's a good question. I'm not sure that Utah has received that kind of money, but even if it has, that doesn't undermine the basic unconstitutionality of that provision. And why doesn't it? Well, if you look at the Commerce Clause has been applied rather broadly. But in the last number of years, the court has seemed to bring it back and say there's a limit to where and when you can apply the Commerce Clause. And it's always been applied as to activities in commerce. And probably the broadest case that is always cited by law professors is Wickard versus Fillmore. In that case, the farmer raised grain on his own property for his own consumption without selling any of it, and never had any grain go off his property. And they said, well, Article 1, Section 8, the Commerce Clause, still applied because it was an activity that affected commerce, and an activity in commerce, because farming is an activity. What we're talking about here is forcing people to buy something they may not want to buy. In other words, they're saying that we can extend the Commerce Clause, Article 1, Section 8, to an inactivity. In other words, a desire not to buy something. Now, if the court does wind up on probably a 5-4 basis and says that this is constitutional and that the Commerce Clause can be extended that far, and by the way, I don't know any constitutional authority who would deny that the fact that this is really a case of first impression. It's never been applied this way before. But if they did that, then that means the federal government could do anything it wants to you, and could make you buy anything it wants you to buy or do anything it wants you to do, as long as they can claim that there's money involved. And I have to say, I don't see how the courts can, and that's why 26 states are up in arms about it. And I think others are ready to join too. I'll tell you what causes even more problems. I don't mean to get off your subject here, but the answer to the question, every state is going to take whatever they can under the current circumstances, I'm sure, and that doesn't undermine the fact that things are unconstitutional in the bill. And that's not the only unconstitutionality in the bill. But, well, let me leave it at that.
Okay, we have time for one more question over here in the front row.
Yes, sir. Probably not, but it could. But I don't know. It isn't going to go anywhere. I think Harry Reid said he could accept the House approach. Now, that doesn't necessarily bring all of the Democrats in, but it's certainly a great indication that they should come in. And what really interests me is that we fought now for almost a year to get rid of 1099, and the Democrats have fought us every step of the way. This onerous paperwork requirement that nobody's going to look at, that's going to cost an arm and a leg, and is going to cause a lot of companies not to hire people so that they can avoid the requirement. And we go through all of that, and then we go through all kinds of amendments on the floor. It really was the amendment of the senator from Nebraska, and then all of a sudden you have the senator from Michigan doing the same amendment, and frankly, in the end, it passed with 82 solid votes. Now, that tells us something, that there's a game going on here, that they're going to hold on to every bit of Washingtonian control that they possibly can. And look, there are some things that Washington can do better. National security is one of them, but health care is not. And if we allow this to go through, if we can't get enough people in the Senate in the next election to turn this around, we're all in trouble, because this health care bill is going to eat us alive. And if we don't have presidential leadership to lead us into reforming the entitlement programs, and that includes the military, which is not entitlement, but nevertheless I'll include that in there. If we don't have presidential leadership to do that, Katie, bar the door. I mean, this country, you probably all noticed that PIMCO's no longer taking U.S. bonds. But it's worse than that. They're selling their U.S. bonds. Now, if that doesn't tell you something, I don't know what does. At least that's what I've been informed. Now, our country's in real trouble. And this is the greatest country in the world. And we're ignoring the systems that have made this country the greatest country in the world. And that's basically the free market system. Now, by the way, just to cheer you up even more, a bill that's even worse than Obamacare is the Dodd-Frank Bill. I think it's going to wind up killing our neighborhood banks that are critical to small business, or at least hurting them very substantially. It is one of the worst pieces of legislation I have ever seen in my lifetime. Again, it's Democrats trying to control everybody's lives through Washington and not allowing the states to have the flexibility to be able to protect us and help us and keep the feds off our backs. Utah is a particularly interesting state. It's considered the #1 state in governance in the country today. It balances its budget. It has a health care exchange, was one of two. Of course, Massachusetts had its exchange. Utah's is completely different from Massachusetts because our demographics are different. And that's the advantage of 50 state laboratories. The demographics are different. People have different needs. They have different approaches. And you should allow the states to work within those demographic needs. And if I have to cite one health care bill where it worked beautifully in most states was the S-chip bill. Now, you notice the letter S? A lot of people ignore that. But I insisted with Kennedy that it had to be the state-run bill. And it was block granted to the states. It was not allowed to be an entitlement. First thing that President Obama did, and the Democrats in the Senate and House did, was they changed the S-chip bill to a new welfare entitlement bill. And frankly, I think ruined the ability of that bill to do what it had been doing. It's still doing a lot of good, but now it's a forceful imposition that didn't have to be. I could go on and on. All I can say is this. The Hudson Institute does a terrific job of getting ideas out. That's one reason why I'm happy, more than happy, to be here today, and hope I can come back on some other issues. I really get mad about a lot of things. And I even get mad sometimes about our Republicans and some of the things that they do, having been formerly a Democrat. But the fact of the matter is, you're doing a great job here. And I just want to pay personal tribute to you, and I hope that I haven't bored you all to death here today. Thanks so much.
Thank you. You're always welcome here, Senator. Please join me in thanking Senator Hatch for coming to Hudson. That's great. Thank you so much.
That's great. Glad to see you again.
I'll send you those articles.